Maayong adlaw mga Iliganons. I am Dr. Jun Ruiz. I'll be your moderator for the COVID-19 webinar on October 22nd, Friday at 3 p.m. on Facebook Live. Our speaker is Dr. Eric Tayag. So, kita-kita na lang tayo. Bye! Good afternoon, our dear friends. Maayong hapon to our fellow Iliganons who are watching this webinar to know more about the different aspects of the COVID-19 pandemic. Welcome to our forum, and we are here just to give you the facts. The title of our webinar is COVID-19, Virus, Variants, Vaccine, and Homecare. I am Dr. Jun Ruiz, a Philippine and American board-certified gastroenterologist from the Medical City, a strong advocate for colorectal cancer screening, an author, an occasional journalist, and most of all, an Iliganon. This COVID-19 webinar is a pioneering project of the company called Newtech Pulp Incorporated, or NPI. It is a US-based company which is located in Baloi, Lanao del Norte, about 12 kilometers from Iligan City. It was bought from Paper Industries Corporation of the Philippines, or PICOP, in 1990, then commercial operations started thereafter. Newtech Pulp is engaged in processing abaca fibers into abaca pulp, which is the principal material in the manufacturing of specialty paper such as tea bags, filter paper, and currency paper. The product of Newtech Pulp is entirely exported to Germany, England, and France. It is on this purpose that Newtech Pulp Incorporated has risen to the occasion to provide a platform for the people of Iligan City to learn more about the virus, vaccination, and how to manage sick family at home straight from the experts and not from the unreliable sources from social media. This is the first of its kind health information drive sponsored by an Iligan City business company committed to serving the people in the community. May we ask our audience who are currently watching to invite your family and friends to join us in this webinar. This is NPI's small contribution in the fight against COVID-19 here in the city. To give the opening remarks are two well-respected leaders from NPI. They are Ms. Petra Borshan, the General Director, and who has been with NPI for 4 years, and Engineer Albert Munyaski, NPI's Mill Manager and Licensed Electrical Engineer. Welcome, Ms. Petra and Engineer Albert.
Good day to all, dear NPI, team and family. Since 1.5 years we are suffering under the influence of COVID. This is affecting our whole life, risk of health issues, restrictions in our daily life, travel restrictions, social distance, and ending up in work from home and loneliness. We all do not like this. But if we are speaking about the new normal, how it will look like, we do not know, I do not know, but I'm convinced we will have not a COVID-free life. We have to take care of ourselves and our families, getting vaccinated and looking for a healthy and happy lifestyle. Finally, we should be careful, but we should be not afraid. Stay safe, stay healthy, and stay happy. All the best, Petra.
Good afternoon. Newtech Pulp Incorporated sponsored this webinar so that we can understand the COVID situation in the Philippines and help us know about the vaccination program of our country. It is more than a year now that we are all affected by this pandemic. We hope this talk and discussion will help us at the same time adapt to the current difficulties and challenges of life. I encourage your participation to help each one of us cope up with the pandemic. Thank you.
Thank you, Ma'am Petra and Engineer Albert, for your wonderful messages to the Iligan City community. I hope everyone who is watching us this afternoon is in the safe comforts in their homes or their workplace. We hope your time with us will lead to more responsible and safer practices against the virus. This pandemic has completely changed our lives. It has been 19 months since we started the lockdown on March 16, 2020, the longest in the world, all caused by an invisible enemy, a virus known as SARS coronavirus 2, the causative organism of COVID-19. The world, including our country, has suffered from the devastation of the virus, resulting in, first, death of millions worldwide, including those of our loved ones and friends. Second, shutdown of the economy, leaving many Filipinos without jobs or money. And third, fear and mental health problems amongst us, partly due to proliferation of myths and fake news. To date, the pandemic has infected more than 2,700,000 Filipinos, and more than 40,000 of our countrymen had already died. Along the way came the mutants, or what we call the variants. First there was Alpha, followed by Beta and Gamma, and now comes the feared Delta. Delta has now become a game changer. It has become the most predominant variant. It is more contagious and easily transmissible 3 times faster compared to the original strain. Delta can cause a more severe illness. Its viral load is 1,000 times higher than before. Children are now getting sicker with this Delta variant. However, we remain hopeful, especially when the vaccines arrive in the Philippines. The first dose was given on March 1 at the Philippine General Hospital. Despite our limited supply, over 25 million Filipinos, or 23% of the total population, had already been fully vaccinated. But we are still far and away from the desired herd immunity initially pegged at 70%. Widespread vaccination is still a critical tool to help stop the pandemic. Then, we have the problem of vaccine hesitancy. What about home care? Not all patients with COVID-19 needs to be hospitalized, especially if our hospitals and isolation facilities are fully occupied. The patient who are asymptomatic or has a mild disease can be taken care at home, and our speaker will teach us the basic principles. The lone infectious disease specialist in Iligan, Dr. Keats Kitos, had revealed in a UP College of Medicine webinar last month that the city needs all the help in the management of the local COVID-19 situation. At that time, the city's occupancy rate of hospital beds was a critical 94%, with a fatality rate of around 7.5% as compared to the national average of 1.5%. There are only 6 ventilators or breathing machines for a population of 370,000 residents. Up to now, there is still no COVID-19 diagnostic laboratory after almost a year of planning. As an Iliganon, these facts are indeed heartbreaking and frightening at the same time. For us to gain more knowledge on COVID-19, we need to listen to the right experts so we can distinguish fact from fiction, the truth from fake news. For our audience, you can post your questions in the comment sections of our Facebook Live. We will try to answer all the questions as long as we have enough time in our Q&A. Our esteemed speaker is Dr. Eric Tayag. He graduated from the University of the East Ramon Magsaysar Memorial Medical Center. He is currently the Director 4 of the Knowledge Management and Information Technology Service of the Department of Health. In addition, he is the DOH Freedom of Information Champion His career is focused on public health, especially on infectious diseases, epidemiology, and universal health care. He has held key positions with the Department of Health for the past 30 years, including former Assistant Secretary of Health and former spokesperson. He is also a former president of the Philippine Society for Microbiology and Infectious Disease and the Philippine Foundation for Vaccination. He is dubbed as the DOH Dancing Doctor. It is with great honor and privilege that I present Dr. Eric Tayag from the Department of Health.
Hello everyone, I'm Dr. Eric Tayag with the Knowledge Management and Information Technology Service. Today I'm going to deliver a presentation on COVID-19, viruses, variants, vaccines, and home care. Recently, the world was astounded by the death of Colin Powell, the former Secretary of State in the United States, dead at 84 after COVID-19 complications. What do you know about COVID-19? First, it was recognized in 2019 in Wuhan, the province of Hubei in China. It's now a pandemic. Initially, it was thought to be transmitted only through airborne droplets, but recently there is evidence that airborne transmission is possible, especially in poorly ventilated indoor settings. Masks should be worn to prevent the spread of the SARS-CoV-2, the virus that causes COVID-19. Many medicines or drugs like remdesivir, dexamethasone, or tocilizumab have been in scarcity in the previous weeks here in the Philippines. Home care is now advocated when hospitals are overwhelmed. In the world today, there are 241,471,559 cases and over 4.9 million deaths. In the Philippines, as of October 18 this year, there are over 2.7 million cases and over 40,000 deaths. We should understand that these surges occur because of the circulation of variants that are highly transmissible, the social mixing that puts everyone at high risk, and safety protocols we do not comply with, as well as the uneven availability of vaccines. But the good news is, here in Mindanao, cases have been dropping. And for example, for Region 10, there is light at the end of the tunnel. Here we show you the COVID-19 cases in Region 10 by province and by age group. Please take note that for Lanao del Norte, the percentage of cases belong to the 20 to 29 and 30 to 39 years age group. Again, for Region 10 by province and age group, Lanao del Norte will report most of the number of deaths at 303, next to Misamis Oriental, which has 386. The number of deaths in Iligan City is now at 206. Here we show you that there are more cases who died among males compared to females in Iligan City. Also in Iligan City, as we show you here on the screen, that most of the affected age groups were reported in September. Here we show you the monthly cases by age group since January this year. So how exactly will you get sick and what are the symptoms? Will you survive getting sick? There's an incubation period on the average of 3 to 5 days, but this can actually be up to 14 days. The reason why the incubation period is related to the quarantine period that is imposed in many areas. When the symptoms appear, it's usually fever, cough, or shortness of breath. Then we are alerted that we may get hospitalized and we may have severe illness because of our underlying medical conditions, and we can actually have critical illness that will make us recover several weeks after the acute illness. Not only that, there are reports that there is a significant number of individuals who recovered who will have symptoms that persist after the period of recovery, and this is long COVID. We have to watch out for variants because the WHO has reported, based on the studies of these variants, that there are variants of concern or variants of interest. The variants of concern have to be watched out for because they have increased transmissibility. There may be more severe cases or deaths, and we may not have enough protection with the vaccines currently in use. When you suspect that you have the symptoms of you may have been exposed, then it's time to get tested. But please remember that the RT-PCR testing is the gold standard. While the United States FDA, that's the Food, Drug and Administration, gave its approval for remdesivir, practically there is no treatment at this time against COVID-19. That is why we have to remember these preventive strategies so that we can prevent the spread or catching the virus. When we wash our hands often, cover our mouth and nose with masks, plus face shields if you can, then we can practically prevent its spread. But of course, this will not be enough. There should be other interventions that we can actually observe, including getting vaccinated. That is why the IATF has recommended just recently alert levels, that's from level 1 to level 5, and this is to assess the risk for each of the area that would require specific interventions such as granular quarantine or lockdowns. Now, Region 10 is now low risk. On your screen, we show you Region 10 in terms of the total active cases, which is at 1,869, and the growth in the number of cases, the average daily attack rate, the risk classification, which I have just reported to you, as well as the health system's capacity. But how about Iligan? Iligan is now low risk. Look at the numbers or percent. But of course, your ICU use rate is 53%. Iligan City is under GCQ until the end of October this year. Now let's go to vaccination. We have to distinguish between passive and active immunity. When you get an infection, our immune system will produce antibodies, and this is natural immunity. But of course, when we get vaccinated, that is artificial immunity. And now we can say that whether you get a natural infection or you get vaccination, your immune system will give the protection we will need when we get exposed in the future. There are different types of vaccines. They can be live attenuated, they can be inactivated, or they can be subunit. As a general rule, the more similar a vaccine is to the disease causing organism, the better the immune response to that vaccine. We want an ideal vaccine, a vaccine that is safe, immunogenic, effective, long lasting, and cost effective. So, when do you get your vaccine? So, if you are still recovering, you may delay vaccination. But of course, if you receive strong treatment, it may take days before you get your vaccine. And for pregnant women, it's recommended that you get it on your second trimester or even the third trimester. There are special precautions for these conditions. The only contraindication is, of course, anaphylaxis or severe allergy. We monitor the safety of vaccines, so it is important that after you get your vaccination or vaccines that you report any events that made you uncomfortable or a trip to a hospital. But the benefits of vaccinating all recommended age groups with either the Janssen COVID-19 vaccine or the mRNA COVID-19 vaccine, that's the Pfizer or Moderna, outweigh the risk for vaccination. Booster doses may be needed, but currently it is not recommended. The World Health Organization has appealed that countries delay the deployment of booster doses even for those who may need it in the future. Here is the situation for the vaccination across the globe and in our region. At least 47% of the world population has received at least one dose of a COVID 19 vaccine. That's over 6.6 billion doses. In the Philippines, we are near administering these vaccines for half of our population. We will clearly see today, as vaccine supplies are ramped up, that more Filipinos will be vaccinated soon. Of course, we want to make sure that everyone will not be left behind. And here on your screen were the priorities for vaccination against COVID-19 in the Philippines. For the adolescent vaccination, we have started it last Friday, and we have involved at least 8 hospitals, international capital region. There's going to be a rollout because this is a phased administration of vaccines for the adolescent population 12 to 17 years of age. But there are comorbidities in this pediatric population that will require vaccines or that are offered now by the government and local government units as well. So there are 11 of them, and these are shown on your screen. It is very important that if you decide to have home care, that transmission can actually be effectively prevented at home, and that sick individuals can be adequately monitored by a professional. We have to be prepared so that home care is safer. Look at the tips we have here for you. In the National Capital Region, we have the DOH COVID-19 Hotline 1555, and we hope that you have the same in your area. That ends my presentation, and we hope we can discuss more in the open forum. Thank you everyone for watching.